For those of you who don't know me, I am Kathy Rocho Kelly, and I have the honor and privilege of chairing this Manhattan DD Council. The Manhattan DD Council also has additional elected officers and committee. And for those of who are here, I will just introduce them. Ellie Roofer, parent co-chair of the committee. And then we also have in person here the co-chairs of our transition committee, Andrew Harris. And new to the transition committee, a very warm welcome to Pat Liu. Yay! And then joining us on Zoom, on the Zoom platform, we have Wendy DeLeon, who co-chairs. She co-chairs the Family and Provider Information Committee, along with Louisa Roach. And for the Manhattan Family Service Advisory Council, we have Mary McGuire here at Synergy. And we have Jackie Goldberg joining us via Zoom. And we also have, I believe, joined us on Zoom, our treasurer, Jesse Backey. And the other officer of the council is Alana Katz, who could not be with us, and she serves as our secretary. So once again, welcome. And generally what we do at our meetings is we will start with announcements. And if you have any announcements of openings or upcoming events, we will start doing this. We will first go to those who are joining us in person. And if you are here in person, you will need to come up and speak into one of the mics. And then once we get through the announcements here, we will then go through the Zoom. So first is Doris.
Hi. Hi, good morning, everyone. My name is Doris Khan, and I am the Outreach Coordinator for New York State Institute on Disability. We are a family support agency for over 25 plus years. And in Manhattan, we provide reimbursement services to Manhattan families for camp goods and other services. And anyone who's interested in reimbursement should call Jackie Tripodi at 929-202-1115, or you can email Jackie at jtripodi@nicetinc.org. Thank you very much. And I look forward to working with all of you this year.
Thank you, Doris. Any other announcements in the room? Ellie?
Hello all. NYC Fair has had to cancel the CAS town hall that we had scheduled for tomorrow. Apologies. OPW was not ready to adhere to the format, although they had agreed. And stay tuned. Hopefully we'll get it done. Yes. Boo.
Good morning, Joanna Santana from Synergia, Director of Family Support Services. Welcome to our home. We have openings for evaluation, for case management. We have openings for family reimbursement, as well as housing advocacy and educational advocacy. So just can send me an email at jsantana@synergiany.org, and I will be happy to help. Thank you. Thank you.
Hi, my name is Tongwen Wang. I'm a social worker with YI Crisis Prevention. Our department is the Community and Family Services. We have programs such as in-home behavior management and in-home crisis counseling. We also have groups including independent living skills and social skills in Manhattan. I mean, there are different numbers, but I think it might be the easiest to contact us at 212-273-6200.
Any other announcements in the room?
Good morning, everyone. Pat Liu from GHO. GHO, we have ongoing waiver service opening, including day hub without wall, and community-based pre-vote and job training program. And also, I want to highlight our family support services, including the non-Medicaid case management can assist family who are new to the system, are seeking for OPWDD service, and then we can assist them to make a referral for the evaluation and linkage to other community resource. And of course, the most important, we have a family reimbursement service. It's available and ready for everyone who live in Manhattan. Call us. We'll give you the detail and assistance to complete that process. And also, finally, we have contract with CDNY. We assist family who speak in Korean or Chinese to do the intake. So my contact phone number is 718-307-6563. Thank you.
Thank you, Pat.
Sorry, apologies. I forgot to add, YI also has a Latino conference coming in October 11th. I will leave the information here as well. Please feel free to go on YI's website for more information.
Okay. And that's it in room announcements. Then we'll use, for those currently on Zoom, we will use the raise hand feature. So Jay,
Good morning, Jay Kleinman from LifeSpire. We have openings in our Manhattan Behavior Management and Parent Training Program. So that can be virtual or in person. And there's no waiting list right now. So to make a referral, just give me a call at 646-338-5632. We also have openings in our Brooklyn advocacy case management. We provide those services as well in Brooklyn. So, and you can just give me a call and I'll put the information in the chat as well. Thanks a lot.
thank you, Jay. Wendy?
Good morning, all. My name is Wendy DeLeon, and I am the Director of Housing Assistance Services at ADAPT Community Network, as well as chairing one of the committees. ADAPT Community Network offers home modifications, housing advocacy, family reimbursement, day habilitation, community rehabilitation, overnight respite, health services, and more. I will be putting in a link on the chat so that you can click on that on how to get started. You can also call our toll-free number at 1-877-827-2666 for more information or to request applications for any of the services provided. I also wanted to mention that we have a new clinic location in the Bronx. I'll be including that flyer in the chat. And also we'll be hosting our annual Family Connect Summit this October 16th. That'll be a virtual event. And I'll also include more information in the flyer in the chat for that.
Thank you, Wendy.
Thanks.
Any other announcements? there's a Jane Nunez. Did you have an announcement or did you just need to mute?
Hi, Kathy. It's Johnny Nunez at CUSAC. How are you? We do have some openings in our Manhattan Day Hab program. I'm the contact person, and the number is 718-728-8476, extension 1222. Or you can send me an email at jnunez@cusac.com. We also may have some openings in our non-Medicaid Manhattan program. The contact person is Brittany Hubraj, 212-244-5560, extension 2059. And she also provides brokerage services. Thank you for your time.
Thank you. Then we also have Christopher O'Connor.
Hi, good morning, everyone. My name is Christopher O'Connor. I'm the intake specialist here at Ebron Community Services. We have openings for our community rehabilitation and respite programs in all boroughs except for Staten Island. We also have openings in our day rehabilitation program, which is Without Walls, located in the Bronx in the Mott Haven area for those residents living in the Bronx and Manhattan. As well, we have an upcoming health fair coming up. I'll put some more information about that in the chat on October 12th, where families can come down to our Brooklyn location located at 6050 Eastern Parkway to get free health screenings and glucose screenings as well. I can be reached at 718-255-5946. My extension is 456 for those that are interested in any new intakes in COMHAC, respite, and day rehabilitation program. Thank you.
Thank you, Christopher. Any other announcements? Then before we move on, I know several people joined us here in person at Synergia. If you have any announcements, no pressure, please. But if you had any announcements, I did want to give you the opportunity to do that. Okay. Okay, then we'll move on next to our update reports. And each month we do have updates from New York City Department of Health and Mental Hygiene, as well as OPWDD and IAC. And I believe Rihanna McKenzie from New York City Department of Health and Mental Hygiene is with us today virtually. Rihanna, are you here?
Yes, I'm here. Yes, I'm here.
I am welcome. I know this is your first time here at Manhattan DD Council, so welcome.
Yes, thank you. Well, we don't have anything specifically to report from the Department of Health. I just want to take this opportunity to say that we do have an opening in our CSB, the Community Service Board Subcommittee. We do have an opening for a self-advocate. So if there's anyone that is interested in being part of the Community Service Board Subcommittee for DD, feel free to reach out to me. I'll put my email in the chat. We just have one vacancy and we would like to fill it with someone. We do the group comprised of currently we have 7 members. We have 2 potential members that's just going through the process of getting appointed. And that usually is to the mayor's office. However, if you need any information regarding what the CSB does, you can always find that info on our on the department's website. But our group does comprise of parents. It does have and it also have providers, and we'd like to fill that one spot with someone with lived experience. So if anyone's interested, feel free to reach out to me. I'll put my email in the chat. Thank you.
Thank you, Rihanna. We'll move on to state updates. James or Sam?
Hi, good morning, everyone. Can you hear me all right?
We're good.
Okay, great. Okay, yeah, I'm here, obviously. I haven't been on one of your meetings in a few months. So it's good to see everyone. Sam is also on the meeting today. And I have to leave in about an hour, but she'll stay on in case there's any questions after I leave. In terms of our updates, so I'm going to just start out with the More Than Work statewide direct support professionals recruitment campaign. I know that we've reported out on the More Than Work campaign in the past, so I'm just going to really focus on the updates. The website is www.directsupportcareers.com. I'll put that in the chat. So the campaign was developed, out of using funding from the American Rescue Plan Act. And we partner with Vibrant Brands Incorporated to do the marketing. So far, we've had 227 nonprofit provider agencies that are participating in the campaign. Since its launch in March, the campaign's advertising has brought in 303,000 job seekers to the website, and more than 20,000 job seekers have visited pages of our service providers, using the links from our website. In August, the More Than Work campaign released to all developmental disability service providers a comprehensive recruitment toolkit intended to help providers enhance their recruitment activities. So the website that I mentioned, that toolkit is available through that website. And if there's any providers out there who have not yet joined and added their agency's information to the website, you can contact us at communications.office@opwdd.ny.gov, and I will put that email in the chat as soon as I'm finished. There is no cost to join, and it's not too late for providers to, to sign up. And, it's just another really important recruitment tool that, that could be added to, your agency's efforts that you have in place now. So, so September 8th through 14th, as many probably are aware, is the National DSP Recognition Week. It's a week-long celebration of the direct support workforce all year, but especially during this week. And throughout the month of September, OPWDD recognizes the work of direct support professionals across New York State, paying tribute to the tremendous contributions they make every day to New Yorkers with developmental disabilities. So just a shout out to all the DSPs out there. And if there's any that are in this meeting, we do appreciate you. Disability Voting Rights Week is September 9th through 16th. So that is just closed. The intention of the Disability Voting Rights Week is to bring voting in our national, state, and local elections, bring awareness that it's available to every citizen, including folks with developmental disabilities. Care managers and provider agencies are responsible to help people who want to vote and make a plan to cast their ballots. Accessible voting equipment is available at all polling places. The deadline for registration to vote is October 26th. Early voting runs from the 26th to the November 3rd, and Election Day is, of course, November 5th. To get help with registering to vote or additional information, we do have an OPWDD voter registration liaison, and I will share his information in the chat as well in addition to his phone number. His name is Michael Orzel. So like I said, I will put that information in the chat. I think in the past we've mentioned the podcast that has had its first episode, which is really exciting. It's called the Accessing Life podcast, led by people with lived experience. It launched, I'm sorry, in July during Disability Pride Month on the 34th anniversary of the Americans with Disabilities Act. So Chester Finn, who I think most of you know, as well as BJ Stasio, are both OPWDD employees. They host the podcast with featured insight from guests who were working to make the world more accessible to everyone. In recognition of the Disability Voting Week, the second episode of Accessing Life did actually release on the 9th of September, and it is available. The first episode explored the world of accessible technology and how it will be used to promote independence, and inclusivity. So there is a YouTube channel that I will put the link in the chat to the YouTube channel, and I would encourage everyone to listen to that, the podcast. It's pretty cool. In terms of the 507 plan, we did hold the Spanish Forum on 9/9 in Harlem. We partnered with Sinergia and Esperanza. Thank you very much to our agency partners. It was a real success. We had the commissioner presenting, Biba Kindo, who is our deputy commissioner, Delia Tucker, who is now our statewide operations director. We also had the state operations director and myself that were there, and we had real-time translation services, and we also had staff, OPWDD staff on hand to answer questions that family members had after the session. So it was a success, and we were happy to be able to pivot. Originally, it was scheduled for the regional office location down in Beaver Street, but we did get feedback from family members and stakeholders that that location isn't quite as convenient. So we were able to reschedule, and we used CUNY space up in Harlem. So it was great. The self-direction program evaluation continues. I will put information in the chat again about what's included in the program evaluation. Guidehouse is the contracted agency that is doing the evaluation, and they've gotten input from a range of different stakeholders and advocates and families that will be included. They are, again, doing a comprehensive assessment of our self-direction model. So I will put all kinds of good information in the chat. There is also on June 11th, there was a meeting that is also on YouTube. So I'll share that information. We're also doing the care coordination program evaluation. So the updates there are that, so far 35 individuals, families have been interviewed, as a part of this evaluation, as well as care manager focus groups and self-advocacy focus groups. So, the goal is really to try to get as much input from a range of different involved stakeholders, families, individuals. So the final report is expected in early 2025. I have a few more updates here. So we are also doing did a managed care evaluation, and we did contract with Guidehouse to do that as well. There's a lot of information out there, as well as the actual report, and I will share the link to the report. Just a couple things that I can mention about the report. It does not recommend a full transition of the OPWDD system to managed care. Guidehouse recommends the long-term services and supports for OPWDDs, such as HCBS waiver services, should remain in a fee-for-service model. The report does offer several clear suggestions and considerations for OPWDD, including the better integration of care for physical and behavioral health needs. The approach may improve the availability and access to specialized care for people with developmental disabilities. The recommendation would not initially apply to the more than 38,000 people served in the OPWDD system already, but Guidehouse recommends a specialized managed care structures be evaluated for this group of people under the second phase. So they're kind of recommending a multi-phase transition. And if OPWDD was to pursue managed care, it should be the first, it should first explore the viability and implementation feasibility of the partial managed care model in collaboration with Department of Health and Department of Budget. And it did recommend that we continue with our strategic goals under the 507 plan, including increasing availability and access to meaningful day and employment services, making regulatory and policy changes to improve health equity and access and reduce administrative complexity, and increasing the capacity to serve those with complex needs. So that was kind of a theme throughout the report. They also made recommendations that we continue to focus on evaluating and improving the CCO model of care coordination as a means to leverage more effective service coordination and person-centered outcomes. The things that they highlighted that were working well. So the system of OPWD home and community-based services and supports helping to meet people's goals, such as residential, day, community hub, and family support services. They noted positive outcomes with care management experiences for people in need of services who could be supported individually for a longer period, and the ability for people to receive services based on their choice through the person-centered planning process. They highlighted some of the areas that that could use some improvement. They noted some barriers in accessing care, including provider shortages and the lack of specially trained providers, and some concerns about the administrative processes that lead to delays. There is feedback regarding the access to quality care is more difficult for people with complex medical and behavioral needs, as well as those living in rural areas of the state. And then they just made a note about consistency in receiving medical, behavioral, and dental care, or simply being denied care. So that was some of the things that they included in their report. In terms of next steps, so no decisions have been made on the recommendations at this point, but OPWDD will further evaluate the recommendations of the founder report, and additionally, outreach to engagement opportunities will be provided so that future decisions are informed by stakeholders and made with transparency. If OPWDD chose to pursue managed care, it would first conduct a feasibility study to assess the potential effectiveness, achievability, and resource need that would be necessary to implement the recommendations of the Guidehouse final report. And it will continue to leverage its collaboration with DOH and the Department of Budget in exploring these options. So again, I'm going to share a link to the full report in the chat when I'm done. If you have any questions about the evaluation, I'm also going to put that email address in the chat. The email address is arpa.inquiry@opwd.ny.gov. But like I said, I'll put that in the chat. Let me see here. Additional updates. I don't think, in the interest of time, I'm not going to go through everything here. In terms of additional agency focus and advocacy efforts, so in acknowledgement of the importance of voices and experience of those who receive services, OPWD is creating an advocacy services office, which will report directly to the acting commissioner. This office will be led by a new advocacy services coordinator, and recruitment is underway. So we may have reported out on this in previous meetings. This office will lead the peer specialist program and oversee the ombudsman program to focus on other advocacy efforts. So in terms of the peer specialist program, they are, recruitment is underway. They hope to have all the staff on board next month. The peer specialists will advocate alongside and behalf of individuals who receive services. It will strengthen the capacity of self-advocates and self-advocacy community to represent their own interests, educate people about civil rights, and ensure that decision makers consider the perspectives of individuals with lived experience by participating in staff trainings, providing input on policies, procedures, and working with OPWDD leadership. Again, the New York State budget did include funding for the Ombudsman program. So that is funded and the development is underway. And I think we mentioned the RFPs that went out previously. The new Ombudsman Community Services Society of New York will help to educate people about their rights, provide a process that allows timely, independent resolution of concerns, and access related to access to delivery of services in OPWDD's not-for-profit and state-operated systems, and refer people to legal representation when needed, and provide data-driven feedback to OPWDD about how to improve the service system overall. So the Community Services Society of New York was selected as the agency. All right, and the program we hope to launch by the end of this calendar year. A few final things. So we are gearing up for the National Disability Employment Awareness Month, which is in October. There's several events and new resources being developed to celebrate the partnerships with businesses who have hired folks with developmental disabilities, and employees with disabilities, and the provider agencies that have made the match. So these activities will include the events around the state throughout the month of October. OPWDD is developing an awareness video and educational video for employers. And OPWDD will roll out an improved employability webpage available with easier access and resources that would be helpful for businesses. So, and we'll also continue to share success stories on our social media platforms. We also participate in the Governor's Annual Disability Rights and Employment Awareness Month DREAM Symposium in October 2024. And so a range of different New York State agencies participate. Let me see, the DREAM event highlights efforts to increase employment for people with developmental disabilities in New York State. And finally, their CSIDD doesn't really impact individuals in Manhattan as much, but Brooklyn and Staten Island, the Services for the Underserved was originally providing those supports. And so they have stepped away from providing CSIDD. So we do have YAI and FREE who are assisting in covering and supporting folks enrolled in CSIDD in Staten Island and Brooklyn. And we'll be looking at doing an RFP, likely an RFP in the future to secure another agency that could pick up that program. There's also some new memoranda. I I can't speak, ADMs and regulation that will be closing for public comment. So I'm gonna, rather than go through each of them, I will just put the links in the chat. But just note that a number of the proposed regulation, and it has comments that are due by the 29th of this month. So so a number of them pathways to employment and supported decision-making practices. Those are the two that have public comment that closes on 9/29. So just please make note of that. So that's, I know I had a lot of updates. That concludes my updates for now. I'd be happy to answer any questions that anyone may have at this point.
Thanks, James. Yeah, we'll start with questions again from the room here. And then we will then also circulate through the Zoom virtual questions as well. So Ellie?
James.
Hi, Ellie.
You know, I think we all applaud the efforts of OPW to, you know, do all the touchy-feely stuff, you know, but the Guide to House report was incredibly disappointing, except for the one sentence, you know. And the idea that the feasibility study is going to go on. Who's going to do it? How much is it going to cost? Are you going to throw it to Guidehouse again? How many millions of dollars do you give to Guidehouse? I think everyone in this room can do and online can do the feasibility study for you, as they could do the self-direction study for you. I don't think you need to throw the money out. I think what most of us in this room are concerned about is every initiative that takes money away from services. No matter what budget line it shows up on, you know, I don't know who you're paying to do the YouTube stuff, but I can do it. You know, I got a camera. I know how to do this. I'm 78 years old. I'm tired. I thought I could get out of this. Margaret, you know, didn't fully step away, but she's not here. Margaret, come back. No, in person. I need you in person. James, I know it's not on you and you know it's not personal, but please relay this. And the idea that your report is exactly the same to every borough, why don't you just put it out online? Just saying. So that we can review it and then have questions so you don't spend so much time. Okay? Bye, James.
Goodbye.
Any other questions here in the room? You need to come up here.
James, how about the video on YouTube just that people share about a podcast so we can watch it?
Yeah, I'll put the information in the chat, including the links to the YouTube video. And then I'm sure, Kathleen, you'll probably relay that information out to your members. Is that correct?
Yes.
Okay.
Yes. In addition to this meeting being recorded and available on our website, the chat is also available, will also be available on the website. Okay, Sandy Levy, I believe you had a question.
Good morning, everyone. Hi, I was unmuted. I'm Sandy Levy from New York City Public Schools at P94M. My question is, I don't know if this would be directed for you, but for Tri-County Care that is being paused, are the other CCOs picking up the services, and how will that operate moving forward?
Hi, folks. Care Design here. Sorry to jump in. I have an answer for you, Sandy. The other CCOs are picking up the slack. Do I sound happy about it? I knew this question would come up. It came up at the Queen's meeting. I don't know if ACA is here. If somebody from ACA is here, please feel free to jump in. Folks, my name is Peter Coleman. Some of you know me. I do outreach at Care Design. And the answer to Sandy's question is yes. Care Design, insofar as I know ACA, I can't speak for ACA, so I guess I'll only speak for Care Design. We are still accepting referrals. We are still working people through the enrollment process, which, as you probably know, for a lot of people means OPWDD eligibility. For a lot of people, it means helping them to get Medicaid. And for far too many people, it involves getting people approved for the waiver through the parental deeming process. There is no other way to phrase this, folks, other than we have been, the normal situation we had prior to the Tri-County pause was not normal. All 3 CCOs were slammed constantly. The post-CCO Tri-County pause normal is even less normal. 1 week alone, we got something like 1,100 calls. So what we have here is a system that is not sustainable, right? But a system where you have 3 companies that provide one service to the entire region. We see what happens when one of those CCOs, for whatever reason, and I cannot speak to the reason because I don't know, is paused. The floor caves in. And that's what's happened, folks. I can assure you that we are doing our level best at Care Design to meet the needs of every applicant. But that's, to say the least, very, very challenging. Okay, it's impossible to field 1,100 calls in 1 week. Impossible. We don't have the staff to do it. And the enrollment staff we have, each person is working with at least 200 people, at least. So we are still open for business. We're still doing the best we can. Okay, but as you can imagine, it's even crazier than ever. Sorry about that. Just thought I'd give you that update.
At the regional office, we are meeting with the CCOs, both central office and regional office. We're also meeting separately with Tri-County to focus on the folks that they had been initiated the eligibility process, and other parts of the process that were underway. We're having them finish that out before the transfer to the other CCOs. But we do recognize, to Peter's point, that it is a spike, to say the least, in enrollments with the other 2 CCOs. And we have, we're aware of the feedback that the Care Design and ACA are concerned about their ability to keep pace with the added workload. So we recognize that.
James, I believe there are 7 CCOs statewide, and there are 3 in addition to the other alternative of PHP, Partners Health Plan, for the dual eligible. But are there any of the other CCOs that operate close to the downstate area that may be able to expand their area to include the downstate?
Yeah, that's an interesting thought. Our CCOs do cross over into Region 5, which is Long Island, and Region 3, which is like Hudson Valley, upstate. But that's an interesting question, and I can certainly bring that comment back to see if any of the other 8 CCOs have capacity. Part of the issue too is obviously their staff wouldn't be located down here, so that could be a challenge. But we're certainly open to, brainstorms and people sharing their thoughts about, alternative approaches.
Thank you. Any other questions for James? And thank you. And we'll move on to IAC update report. Richard Bosch.
Good morning. Let me first say, I wish I could be there. I enjoy the in-person meetings. I haven't been in the office since April because of surgery that my wife had that went wrong, and I've become a nurse, but I've also trying to get back to work full time. And that said, thank you, James. Thank you, Ellie. Thank you, Peter. I mean, this is getting overwhelming. I just wonder on the CCO, which is a major, major issue. I wonder if there's thoughts of giving care management back to the agencies through MSC. Probably not. But this sounds like a major disaster in the works. It was already taking like up to a year to get people enrolled, and it never took that long before. So I think there's going to be a lot of discussions on this. To Ellie, I totally agree with the Guidehouse report. I was at the Bronx Council meeting and did a presentation, and everything in that Guidehouse report, you could have just listened to any of the DD councils before and not spent the money. Right, Ellie? So yeah, it's a lot of money spent for things we kind of knew already, and why OPW continues to spend so much money on research and study. I guess they want data, but that has to be looked at. I think the 5 councils need to continue to discuss this. James, thank you. I don't know if you put the link up yet to the Guidehouse report. I couldn't find it today. I found it before and I printed it out, and now I couldn't find a link.
Yeah, I'm working on that now.
Okay. The link I did put up, it should be the first one in the chat, is a report from the Coalition of Whole Person Supports, which is a special initiative by providers, families, advocates, and OPWs even in there. So we're going to hear a lot about that. Kathy, I would encourage you and the other councils to figure out a way to have a webinar on this, or I'll go back to Winnie at IAC to see if we want to have more discussions, broader discussions, so people become aware of the Coalition of Whole Person Support. So that, and James, I want to thank you for such a very thorough and long report. A lot of important items here. So I encourage you to continue that. I haven't heard that kind of report from the regional office in a while, and I get to go to all the council meetings. So where should I go next? Let me give a kind of a more typical report, since this is the first meeting of the year. Lobby days. IAC, for those of you who participated before and haven't, we're going back to the old way of doing lobby days, where we IAC makes the appointments with the legislators, and we go up to Albany for 2 days. It'll be February 25th and 26th for the main lobby days. And the education lobby day will have its own special lobby day on May 6th. And yes, we're going to reserve rooms at the Albany Hilton. And yes, we're going to meet the evening before lobby days downstairs to give a presentation and an overview of what we're doing. So we're back to the old way of doing it. And we have a lot to discuss, including everything that James and Ellie, everyone brought up. So I won't go into them. Just a quick preview on budget positions, and those are not final yet. But we are going to be asking OPW and actually Division of Budget to make an investment in the system. We're not going to call it a COLA anymore because that got everybody confused. So we're going to make an investment of asking for 7.8%, which is that was composed of a CPI of 2.9% plus 2 years where the CPI was not given. The system is not being well sustained with the funds that are needed. So we're going to be looking for that. We also may be asking for an independent government appointed commission to look at and study wage adequacy. We can't be continuing to say, well, we just can't pay enough to attract people. We have to start attracting people. We have to start training people. A lot more investment in the system. So the other major issues, I think you mentioned voter registration ends on October 26th. Everyone needs to get out to vote. If any of the agencies present have their own system for getting people to encourage them to register, please share it with Kathy and with me at IAC, and we can share that to get people registered. And please don't register your cats and dogs because we'll bring them to Springfield, Ohio. Sorry. The other more immediate issues, the April 1st rates for IRAs and day programs and other things that has been posted, and we understand that the payment will actually come on the 26th. We're still waiting for the July 1st rates. We're told by the fiscal people at OPW that there's 8 to 10 agencies that didn't respond to the survey and therefore they can't release the rates. That's a strange explanation. We'll try to find out more, but stay tuned. We know the fiscal intermediary contracts have been an effort. OPW is trying to update them, but only a handful have been updated so far. The way the contracts are set up by Office of State Controller and Division of Budget just don't match the program because people come looking for self-directed services. You need a fiscal intermediary, and it's everything gets bogged down, and that has to have a major change. I've heard a lot about the graduates coming out of the day programs, that there's not enough opportunities to serve everybody who needs a day program. I've also heard a lot, maybe this is something for lobbying efforts and something for the councils, state-funded services. It comes up at every council for the last few years. Whatever happened to family support services where they don't have to be Medicaid eligible? And you go back to the good old days where there was tons of money and Medicaid wasn't involved. Medicaid was brought in because it had the money, but you have to be Medicaid eligible to get that service. So a lot of the family support services are no longer available because those state dollars aren't there. And it might be something else we all have to push for because there was so much flexibility of family support. So we're going to keep our eyes on that. So I guess I'll finish now because so much information has been shared, but let me just, the one thing IAC has somehow become is when somebody runs away from their home or is missing or wandered away while on a day-have trip or whatever, they contact IAC, specifically me, and said, this person's missing, can you post this? we're going to be sharing with all the DD Council the latest guidelines on how to communicate that in the best way. The thing I have to say is always make sure you have an up-to-date photo of all the people that you provide services to. It really helps to have a photo because then they can be identified quicker. A lot of the people end up in hospitals, and I've received communication from hospitals with a picture attached, say, do you know this person? And then I post it out to our agencies and everybody on our 4,000 people in constant contact, and usually we find them quickly. Also, I'll ask you, when you do post missing person notices, do not include family names and phone numbers. It's wide open for abuse and fraud. You want the police precinct number in there, police precinct, number of the precinct, and the agency that's reporting it. But I'd say police are the most important. I've also put out a special number for the state office that handles missing people, as well as the city office. And I'll see if I can get that into the chat before the meeting's over. But it's something we take seriously. And it can be a wide variety of people, some who have very limited skills and are wandering around out there lost. Others are disappeared to go see their best friend for the weekend. So if you know where this person usually goes, it's good to advertise that so we can come back. As far as I know, we've never lost anyone permanently, but it's very scary for the family and the staff that know the person. I went through it like almost 40 years ago where a person was missing, and we couldn't get the TV stations to publicize it. We finally did through a contact I made. And when they found the person, the soles of his shoes were totally worn through and they were brand new when he left. I think he lives in a state operated home now. So anyway, that's probably enough for now. But keep up the communication and the information sharing. Again, James, thank you. That was good. And Ellie, you need to get Margaret back. We'll help you. But thank you for saying that about the Guidehouse report. Any questions?
Thank you, Richard. Any questions for Richard? Thanks, Gary. Before we move on to committee reports, I just want to let everybody know that Manhattan PD Council, as well as the other councils, have historically charged membership dues. And this kind of went on pause during the pandemic when many of our events kind of got put on hold and we started to meet virtually solely. We are going to reinstitute membership dues for Manhattan DD Council. And this is for provider agencies, and you'll be getting a flyer and the invoice via email within the next week or so. But generally speaking, the dues is required to assist us in funding our various events, primarily our annual Family and Professional Resource Fair, which we hold each year. We had it most recently in person at CUNY Graduate Center. And we do expect to have another one, most likely at the CUNY Graduate Center again in the spring. So the dues goes to help fund that. In addition, some of the benefits for dues paying members is that you have your agency listed on our website as a member agency with a link to your website. We will also post events for your agency on our website. And there is also a discount that is provided for the vendor tables at the resource fair for member agencies. So we are bringing back the membership dues beginning this year, and we'll be sending out a flyer with information on that shortly. And we'll move on to committee reports. I'm sorry, Jackie? Jackie, did you have your hand up?
Oh, I'm sorry. I wasn't sure what you were asking. I do have my hand up. Can you hear me?
Yep.
Okay. Question about membership for non-providers. What constitutes a member of the Manhattan DD Council? I've been asked this question.
Membership dues is only charged for provider agencies.
The dues, I'm just talking about, are you a member if you come to meetings? Is there any membership criteria for non-providers?
For non-providers, members do participate in voting. And for non-providers, you need to attend. For non-agency providers, you need to attend at least 3 council meetings between September and May.
Thank you.
We have elections every other year for executive committee positions. Then we'll move on to committee reports, and the first will be the Manhattan Family Support Services Advisory Council. I don't know if Mary or Jackie, you want to keep yourself unmuted, Jack?
Yeah, you know how long it takes me to unmute, so that would have been wise advice, but I'd already pressed the button. Good morning, everybody. Sorry I couldn't be there in person. We are co-presenting with the Manhattan Family and Provider Committee a presentation on family reimbursement. That'll be tomorrow at 10 a.m. And Mary, I think, probably already just put the link in the chat. We're going to concentrate on aspects of family reimbursement that have changed recently, some of the new allowable items, what kind of clinical justifications are necessary. And we're also going to talk a little bit about the intersection between the self-direction budget and family reimbursement. So we've gotten some new information on that. And I will be presenting with Janet Davis tomorrow. Thank you.
Thank you, Jackie. Next, while we're on that, Wendy, do you want to go next on Family and Provider Information Committee? I know you're having that meeting, but any other info on the committee?
Yes, we will be resuming our meetings every other month. So we are taking odd months, so September, November, and so on, for the second Wednesday of every month. So please keep an eye out for those emails announcing upcoming meetings. But I did want to say about the fair, obviously, Kathy mentioning it, it's never too early to start putting it together. But if you have ideas on topics, any particular presenter that you may want to see, or as the year goes by, if you participate in any webinars, attend any conferences, there's any topic or presenter that you think would really benefit Manhattan families, please let us know. The purpose, or one of the purposes of the event, is to bring information to families in Manhattan about either resources or policies that are changing, or anything that really is coming up that would affect them. So as a committee, as a council, we would like to ask, and I'm sorry, Kathy, I'm just kind of taking it on this piece here, but I would like to ask all of you to please help us in putting that aspect of the fair together, because we want to make it as relevant as possible to the families, and to our colleagues there in Manhattan. That's all I have to say about that. Thank you.
Thank you, Wendy. And our final committee is the Transition Committee. Pat, Andrew or Pat. And again, for those of you who did not join us initially early on, I'd like to once again announce that Pat Liu from GHO will be co-chairing the Transition Committee for us with Andrew Harris.
Yay!
Beautiful. So our focus is on supporting youth with IDD living in Manhattan, transitioning from high school into the world of adult services. And we meet opposite months from the Family and Provider Information Committee. We're even numbered months, second Wednesdays, 10 a.m. We sponsor a couple annual events that we're continuing virtually this year. The first one is this October 9th, and that's going to be an overview of the adult service system, including things like DAHAP programs, supported employment, and kind of a overview of how you get connected with those services. That's October 9th, 10 a.m. on Zoom, Zoom link coming soon. We also sponsor in February an adult services meet and greet that is made up of brief presentations led by provider agencies covering their services for that population of adults with IDD. We're doing a little bit of a change this year to our other mid-year meetings. We're looking to host some of those meetings in person in order to promote some more networking among stakeholders with a particular focus on schools and provider agencies, bringing people together, making those connections. We are looking for space. If you are an organization that has space, we'd love to talk with you about maybe hosting 1 or 2 events. And I am good at missing things, but I think I've covered everything. Thank you. Oh, and excited to be working with Pat Liu Cheng. Should be a really great year.
Thank you, Andrew. And just a final note, it has been absolutely great to get back to a hybrid and at least some aspect of in-person meetings. So we absolutely will continue to do that. We are looking for space. So if you are a provider that has space in Manhattan that can accommodate a hybrid meeting like this, a special, once again, thank you to Synergia for taking the leap and offering to help us do this the first time. I think it was very good and very well attended. Great to see people back in person. We will be having our next meeting the same way, hybrid, and that will be on Tuesday, October 15th. We generally meet on the 3rd Tuesday of each month. And next month, we will be back here at Synergia, and that's 2082 Lexington Avenue on the 4th floor. So we'll have that posted on the website as well. So just want to double check to see if there are any final questions, comments, concerns, suggestions. Ellie?
Right? So come to the in-person thing. Maybe there's food, maybe that's the hook. I don't know. But there's good food, and maybe there'll be coffee next time. I'll deal with the coffee if that's but it's such a much better experience in person. And we'll probably get ideas for the next meetings and all of that. So, do it. I'm just saying, do it. I woke up this morning and said I was going to an in-person meeting and that I was also going to throw away all my COVID pants in the closet, never to be worn again, that kind of thing. So do it. Come out. I'm looking at you, Wendy and Margaret and everybody and Jackie. All right, later. We'll see you all in person.
Okay, thank you. And it was great to see everybody here as well as on the Zoom link as well. Thank you and have a great week.